that I should be carrying around. That's why at the rush I have to put them away. Thank you for the kind introduction. So now you know a lot about me, and I know nothing about you guys. Huh? Anyway, we're going to talk a little bit about heart-healthy living. February is American Heart Health Month, and so hopefully we'll learn something about heart health and empower you to make some changes in your life that will help you improve your quality of life, and more importantly, the quality of life for the people around you. Because when you have an illness, it just doesn't affect you. It affects everybody else around you too. So heart disease is the leading cause of death in the United States for both men and women. As much as we've been trying for so many years, we still can't make that dent by not being number one. I like to be able to say we're not number one anymore and have cancer or something take over, but still not there yet. Heart-healthy living involves understanding your risk and making healthy choices, taking steps to reduce your chances of heart disease and coronary artery disease. So with this talk today, our goal is to raise your awareness of your risk factors, raise your understanding of the heart health, encourage you to make these changes. You have a handout with you that just shows what we're going to cover today, and most of this will be fairly simple, and you've seen this, I've heard it many times before, but hopefully we can put it together in a coherent package that you can take it home with you while you're having coffee with your friends or somebody looking at a snack, looking at this sheet and say, hey, there's something I can do to help make things a little bit better. Okay? So first is understanding the risk for heart disease. So the first step for understanding your risk is understanding what these risk factors are. So risk factors for heart disease include blood pressure, which we know, high cholesterol, overweight or obesity, pre-diabetes or diabetes, smoking, not getting regular exercise, if you have a family history of early heart disease, and that's if your brother or father have heart disease when they're less than 55, or if your mother or sister have heart disease when they're less than 65. So there's a 10-year protection there that women get from their estrogen. But once you go through menopause, you lose that protection. If you're a woman, if you have history of preeclampsia, which is your blood pressure shoots up, you have urine that had a lot of protein in it during pregnancy, that sets you up for a higher risk of coronary artery disease later. If you have unhealthy eating behavior, or if you have, I guess it's not a risk factor, it's just that we get older. So for men, it's greater than 45, for women, greater than 55. When you get there, that increases your risk. And more, we're starting to understand that stress becomes a big risk factor for us, along with poor sleep. The data and the studies from the poor sleep that's coming out, it's just unbelievable in terms of how it affects your risk for diabetes, your ability to control your hunger, and the risk for dementia. So good sleep health is now another major factor that we're starting to pay attention to now. Okay? Some of these risk factors can be changed, some you can't. Age, family, history, gender, you're stuck with it. So even if we do everything right, we know that heart disease will eventually catch up to you, but we want to push that horizon out for as far as we can so that it doesn't get to you. Women still get heart disease, and you get that 10-year protection from the estrogen, but after menopause, you get heart disease just like men would. Middle age is also a time when other things come on, including your diabetes, blood pressure that comes on. Okay. Preeclampsia too, remember, that's another risk that women have to deal with that men don't. So now that they know about cardiac risk, what can you do? First off, let's get your blood pressure and cholesterol checked so that you know how to control it. Most people get their blood pressure checked once a year and cholesterol checked once a year. If you leave your blood pressure high, it's a silent killer because the force of the blood pushing against the walls of your arteries increases, And if it stays there all the time, it causes damage to the wall and start the plaque formation. And it is in this damage and the plaque formation that causes the repair that increase the thickness and thus more plaque formation, and then the stenosis start. We know that from autopsy results, for American, the plaques start building up around age 20 to mid-20s. So already it started there. So we don't control it. By the time you get to 50 and 60, of course, it becomes significant. Any questions so far about the blood pressure?
I have one.
Yes.
If you have your own blood pressure thing at home, how can you make sure it's accurate, and what can you do to fix it?
Right. I will speak only to the radio, the brachial. Don't use the radio. That's too much variation there. By and large, most of them are very accurate. It's the user error that tend to make it inaccurate. Okay. But if you don't know if you're using it correctly, take it into your clinic and doing that 5-10 minutes before your physician come in and you're dealing with the nurse. They tend to have a lot more time, a lot more patience to explain that for you. And you can check left, check right, and then alternate back and forth to see where it is. Yes, it will change by 1 or 2, but it's fairly consistent in that change of 1 or 2. Okay. So good question about blood pressure and how to use the cuff. Blood pressure is high when it's 140/90. So if you see 140/90, you start thinking, something's going on here. I got to monitor this a little bit more. I got to watch my diet a little bit more. Okay. So next is high cholesterol. Cholesterol is a substance that's in your blood. We need cholesterol to survive. Without cholesterol, your cells cannot become stable. You would leak fluid everywhere. Parts of your cell would just travel without any containment. So you need cholesterol. It's that excess cholesterol that gets to us. When you have excess cholesterol, your body will try to put it away, to store it in places. So it's stored in fatty cells and it's stored in your arteries. And so the arteries are the thing that we monitor. So when the cholesterol gets stored in there, and it's the bad cholesterol, that it's atherogenic. So that means it tends to make things sticky and start building up in there. So if you got a little area that deposited into your artery says, oh, this stuff's not supposed to be here, I'm going to seal it off. And then again, this thickness starts building on itself, and then pretty soon you get a dome of stuff that is underneath this little plaque. And if you look at the artery and you got a dome in there, that's how the blockage starts. So you get this dome that starts. And later on, if we have time, we'll cover some of the mechanism of how a heart attack happens. And it's that dome that you don't want. That's full of cholesterol underneath it. Okay. All right. So you got your blood pressure check, you got your cholesterol check. So now what? Now that we know there's some risk factors that have to be modified, then you start choosing our heart-healthy food or heart-healthy diet. Heart-healthy diet involves choosing certain fruit, vegetable, while limiting other. So vegetables good, fruit's good. You avoid the saturated fat. If you have to eat fat, you eat the mono and polyunsaturated fat. It's like, what are those? Those are canola oil, olive oil, sesame oil, sunflower oil, but not coconut or palm oil. Those are not unsaturated. You can go and look ad nauseum about what to eat and what not to eat. To boil it down, if you have high blood pressure, you should try the DASH diet. So that's the diet approach to stop hypertension. Or I think one of the easier ones to follow is Mediterranean, because it still allows you to get some of the fat, the oil into your diet, still allows you to get some of the tastier food into your diet. It's just that it does cut down on your calories and it does try to increase your green leafy veggies. But data that's coming out that says the most beneficial diet that we know of is plant-based with low animal protein. So plant-based with low animal protein, and along with that plant-based is a lot of green leafy vegetable, because that's where a lot of your antioxidants come from. And some of the beans and legumes also have your antioxidant in it. So if you want to live forever, that's what you eat. It may not be the funnest diet, and it's hard to cook that diet if you don't grow up with it, because it requires a totally different type of thinking, different type of shopping, different type of food prep. So it is good, but it is hard.
So the animal includes fish?
Yes, fish is also in that animal. So people just say, oh, well, I eat a lot of fish all the time, but then they're frying it and they're dipping it in all sorts of batter. So it kind of nullifies it. But yes, it still is in there with the animal diet. So they would recommend that you have, if you go onto this plant-based diet, they would recommend that you have 3 to 5 servings of your animal protein a week. So there's a lot of meals in there that have no protein or animal protein. It depends on your legumes and your beans to get your protein. You also should limit sodium. We need sodium to survive. We need 400 milligrams of sodium to survive. Without it, you die. The normal American diet is 3,000 to 5,000 milligrams of sodium. Okay? So the recommended amount is somewhere around 2,000. So 2,000 if you can tolerate it. 3,000 and 5,000 is too much. Now the reason people like sodium is because sodium is a molecule transport. It transports the taste into your taste bud. That's why salty food tastes better. Oil and fat also transport molecules of food. That's why high fatty food tastes good, because it transports all those molecules to your taste bud. The problem is, once you do that to your taste bud, they get desensitized. So they basically get blunted. And so then you have to increase the fat, you have to increase the sodium to get there. That's why some people salt their food before they even taste it, because they know they need the extra molecule. Right? But it's doable to do this and allow this to come back up. But it takes about 3 days to do it. So I went to a program where patients come and we control everything about their life for that week. We control what time they get up, what they eat, how much they exercise, where the snacks are, their meditation and teaching. So your normal day is 6:30, 7 o'clock, get up, because by 7 o'clock, you're meeting in a gym somewhere to go through a meditation process. 7:30, you start doing some exercise, whether it's walking or light weightlifting. We're teaching people how to exercise. 8 o'clock, you go to the cafeteria. 8:15, you eat with your people, with your colleagues. 9 o'clock, you start learning a class about cholesterol or hypertension or diabetes or mental health. We control this whole thing about people, and very low salt, very low animal protein, and there is only Mrs. Dash and something else for your spices on the table. I get there, and I tell you, the first 3 days, I couldn't taste the food. And I thought I was eating healthy. I couldn't taste the food. And I look at the lady that was running the course, and I says, how do they do it? It's like, because I'm there as a medical person, it's like, you got to coach them. It takes 3 days. The first 3 days, their food's going to taste like cardboard. They can't tell the difference between a cooked carrot or a roasted carrot or anything. But the third day, you start getting it. And she was right. It took me 3 days before I get all that taste back. And then I can tell the difference again. And when we control people's lifestyle like that, we check their cholesterol the very first day they get there, and we check their cholesterol the very last day they leave. So by day 3, they get to see what their cholesterol numbers are. And it motivates some of them. Some of them say, I don't care. I'm just here for the week. That last day when we check their cholesterol before they leave, they don't get to see it. They see that about 2 weeks later. And by and large, we see a 30% reduction in their cholesterol just for that 1 week. But that's getting total control of their lifestyle and everything. By day 3 or day 4, most of them get tired because their food changed so much. But as a medical person, we have to make sure that they're not over-medicated. If they come in with 3 or 4 medications, by day 3 or day 4, they're over-medicated because their diet changed so much. then we have to pull some of their antihypertensive or their blood pressure medication off. And sometimes they're so bad that you have to then, on the backside, push Gatorade so that their blood pressure stay up. Because we took so much sodium away from them, their blood pressure went like this. And their medication just pushes it down even further. So we know we can make it. We know we can make the change just based on diet and exercise, but it's so hard to do. People will fail because when they go home, their family will say, "Why are you eating that?" Okay. All right, so sodium and saturated fat. Try to keep it less than 10%. If you have read Ornish diet, he's down to 3%. That's really hard to do, especially in this culture. But you can cook with applesauce to caramelize and give it the little burnt taste. So there's creative way to do it, but 3% is really hard to do, especially if you eat out at all. There's just no way you can do it. Yes, question?
Can you put that into like an equivalent of 2,000 milligrams of sodium is a fourth of a teaspoon? You know what I'm saying? You're saying, how do you
Yes,
measure
yes, yes.
How would you measure that?
I did look this up.
2 shakes?
No, no, because, no, it's in teaspoon. It's up to teaspoon, yes. But that's hard to say, and I hesitate to do it because the Himalayan salt are less sodium than the stuff that we get out of the can.
How about sea salt?
Different sea salt have different sodium content. So it depends on where you get it. You have to read the label. Because some of the bigger, chunky sea salt that they market have less sodium. And I think that's how they're saying that it's healthier, is because you can shake bigger amount on there and not getting the same sodium. Yeah, so they're very creative. And the thing is, they're creative to sell their product, not for your health. So it's up to you to kind of control that amount that comes in. Okay? So saturated fat, if you can keep it down to 10%, that would be great. I know that's hard to do, even at 10%. Sugar, try to limit that as much as possible because that's calories, and the more sugar you get, the more it's going to increase your insulin resistance, and then that led to metabolic syndrome, and then that leads you down to the road to diabetes. Okay? How much should you eat? I don't know. That's different for everybody. There are some people that eat 5,000 calories, some people that only need 1,400 to survive. We know from our data, and unfortunately this came out of all the incarcerations, jails overseas, people need about 700 calories a day, really. That's all they need for their metabolic need. And so even when you recommend the minimum ADA is 2,000 calories, you still got plenty. And if you're eating 3,000 a day, which is normal for people, you're storing away a lot. So if you just do that, you gain about a pound a week. And if you multiply that over 52 weeks, if you're not doing stuff, you're going to pack on 50 pounds easy a year. Okay. So if you read Blue Zone, people read Blue Zone at all, know about this, where people are living for a long time. One of the main things that most of those coaches do is that they have this deal where you eat to 85%. Whatever you think you're going to be full at, stop at 85, sit and talk for 5-10 minutes, and then you feel full anyway. But it's that 5-10 minutes of socializing that helps you get there, because it takes you about 10 minutes for your stomach to tell your brain, hey, I'm full. Unfortunately, most of us now, if you eat with a phone or watch TV, 10 minutes, you're done with your meal before your brain even get a chance to say that it's full. But if you sit and talk with people, it'll take you 10 minutes to eat, and then you feel full. But if you're in your phone, you're reading, 10 minutes, done. Your plate's clean. You already ate past that 85%. Okay. All right, so now that you got a healthy diet, what should you aim for your weight? BMI, body mass index, that's what we're looking at. So that calculate your height, your weight, and add your age in there so it can figure out where you want to be. So the BMI that you want to stay at is between 19 and 24.9. because when you cross into 25, you're already slightly overweight. Okay? So just for references, 5'6", that's what I am. 5'6", you should be at 150. That gets you to 24.9, 50 pounds. I'm over that. 5'10", 170, 6 foot is 180, 6'2" is 190. So anything above that 25, you're into the overweight, and then above that, into obesity is 30. So it's really hard to stay at that perfect ideal weight. How do we get those numbers? That's what the insurance actuary use. So they know, they track you, they know who's going to get whatever disease, and so that's how those numbers came out. Okay? The more body fat you have, the more weight you have, obviously, and that increases your risk for high blood pressure, diabetes, breathing problem, and certain cancer. And the way that fatty cells causes obesity is it creates its own environment. And what it does is it causes insulin resistance. So if you can think about it, it's your pancreas and your fatty cells. They interact with each other. And the more fatty cell you have, the harder it is for your pancreas to tell the other cells, hey, this is what you should do with your sugar. And because of this interaction, the pancreas have to increase the messaging, which is insulin. So it has to give more insulin to tell the fatty cell, hey, behave, keep your blood sugar low. These fatty cells aren't listening. They scream a little louder, your pancreas has to scream a little louder. And so it ratchet up this little thing until your pancreas burn out, and that's how you get diabetes. So people, before they go to full-blown diabetes, actually can make a lot of insulin. Their body have a lot of insulin in there. And even during their journey through diabetes, their insulin level is high. And insulin is one of the growth factors. So that's why then they gain weight. So just because of the extra in there, they gain weight. And if you know people with diabetes, they have diabetic retinopathy. So if you got your optic nerve, and remember, insulin is a growth factor, it causes these arteries in your retina to grow, and as they grow across the retina, and you can't see past those arteries. And so that's what happened when they do the laser therapy, is they burn some of these off so that you can still receive the message to your optic nerve. Okay? So that's part of all this stuff about diabetes causing other things, because it increases this growth factor. And we think that's why it also increases your risk of cancer, because the growth factor makes it so your body can't check itself, because you constantly have checks and balances. You get a bad cell, your body says, oh, this guy's not supposed to be there. I'll go get rid of it. And the cell itself says, oh, I'm not supposed to be here. I'll self-censor and I'll die. But if it loses that self-censor and your body can't check it, cancer then proliferates. Okay? So that increases your risk also. Waist circumference, it's one of the easier way to kind of monitor you. If you have different type of obesity, if you pack your weight here, that's actually less harmful than you pack your weight here in your belly. All right? So for female, anything above 35 inches increases your risk for diabetes, metabolic disease. For male, 40 inches. Some quick thing for you to look at. All right, maintaining a healthy weight. Remember, 24.9 BMI, okay? If you can keep it down there, you're good. Now, if you're above that and you're trying to lose weight, it's like, do I have to get all the way back down to my perfect weight to get the benefit? No. If you start losing at 3 to 5%, already your blood pressure is going to come down, your blood sugar is going to come down. If you lose greater than 3 to 5%, your good cholesterol start going up, your bad cholesterol start going down. Okay? So any changes is good if you can get down to ideal, perfect. If not, you're still getting a lot of benefit. All right, so now that you got your blood pressure, your weight, your cholesterol control, what's next? Well, one of the things that helps you get there is regular exercise. So he said, oh, how much exercise do I have to do? Well, if we go by the recommendation amount, it's 150 minutes or up to 300 minutes a week. So that's 5 hours. And the number that you hear all the time is, boy, if I get 30 minutes a day, that's fantastic, right? Remember, 30 minutes a day, if you do that 5 times, you're at the 150. You're at the bottom. It's like getting a C in class. They're not passing yet. I mean, you're passing, but you're not really doing well. So you want to get up into the 300 if you can. Who has time to do that, right? So we know that if you do moderate exercise, you want to try to stay in that 150 to 300. But if you can't have time to moderately exercise, if you do exercise that's considered vigorous, and for most of us that would be running up and down stairs, you can cut those numbers in half. So if you only have 10 minutes for a break, you can exercise during that 10 minutes, and that count almost as 20 for walking. So vigorous, you can cut your amount. Right? But that means you got to be honest with yourself. Okay, what is my amount of vigorous? In some people, vigorous mean really running 10, 20 minutes. In some people, it's getting up 2 flights of stairs. That's rigorous. So in order to do this thing, a lot of time you need somebody to kind of watch you and help you so you don't hurt yourself. And that's when a physical therapist or somebody that's well known in physical training can help you through it so you don't hurt yourself when you start out. Just because some doctor says, I gotta get 300 minutes. Yeah, and then you end up hurting yourself. Okay. A lot of people have these watches now that monitor their steps. For a lot of my patients, I say, just try 10,000 steps a day. Something for you to look at. Okay. Another factor for heart health is managing your stress. How do you manage your stress? Right? You have people that cook and clean for you and handle all your job and all your work. Yeah, but talking with counselor, I think is a major thing. They have so many ideas that help you deal with stuff that you can't solve. We're not going to solve it all, but maybe you can come up with some strategy to put it aside and say, it's not going to bug me 23/7, because the other one I'm asleep, right? So we know that with good mental health, you have better heart health, but more importantly now, data that's coming out says less dementia. If you let stress and catecholamine increase in your brain all the time, your dementia onset is much earlier. Okay? We don't have data that says depression causes coronary artery disease, but we have a lot of correlation that we see people who have coronary artery disease also have depression. Okay? So there's a connection there. We just can't say that it causes coronary artery disease. But we do know that if you have a heart attack and you have depression that's not treated, you're going to do way worse than the person that's treated for their depression. Okay? So we can't say that it causes coronary artery disease, but we do know that it definitely affects your mortality and morbidity. Stress-induced cardiomyopathy is a well-known issue for us now. Have you heard of broken heart syndrome? So, and this affects predominantly female more than male, and postmenopausal. We don't understand the exact mechanism in there. It has something to do with the hormonal protection, obviously, because it's postmenopausal. But women can come in with some psychological stress or illness, and they'll look just like they're having a heart attack. They have severe crushing chest pain. They have EKG changes. When we look at that ultrasound, it looks like their heart is not moving, like it's having a heart attack. But when we take them to the lab and look at the arteries are clean. So we know there's something going on in terms of the stress. And it was first described as takasubo, which is a Japanese word for an octopus trap. Because when you look at the heart, it looks just like that. It looks like it's just not moving. Okay? But the good thing is, with that type of diagnosis, once you get rid of the stress and we put people on medication, their heart function recover and they go back to normal. So whatever is going on with that stress, it's so severe that it can cause people to have a presentation just like heart attack. Okay. And the big one, quit smoking. Quit smoking. We hear it all the time. Quit smoking. Quit smoking. Well, there's nothing that I can do or give you that will give you that nicotine hit. If you're a smoker, you know, when you smoke and you take that drag, it takes 9 seconds from the time that you take that inhalation to the time that nicotine hits your brain cell. And there's nothing that I can give you that will feel like that. So what I tell you to do is quit smoking, you're going to feel horrible. Right? So that's why it's hard for me to beat that addiction. But it is one of the more important things that you can do, because the cigarettes and the stuff that's in the cigarette causes your platelet to get really sticky. So that's the fancy term for that is platelet aggregation. Well, platelet aggregation then turns into clots. And clots, if you already have some blockages inside your arteries, during that time will make it stickier as it's going through the area of blockages. And guess what? The cigarette also causes vasoconstriction. So if your arteries look like this, and you already have some clots in there, you're in your vasoconstrict, guess what happened? It gets that like that, and then you get your platelets sticky and you tend to form clot. That's the perfect storm for that heart attack to happen. Yes?
What about vaping? We hear so much about vaping, but I know it's not good. I don't do it, but I'm just saying, would that have the same effect? Because most of the time they don't even know what they're vaping.
We don't know for sure.
Oh, okay.
Yeah, we don't know for sure. And the thing is, a lot of the vapors are younger. Some of the older vapors that switch over from cigarettes have already increased risk. Right? So we know that it causes the vasoconstriction. I'm not sure if I can say it causes platelet aggregation.
Causes lung damage.
Oh yeah, yeah. You get this new popcorn lungs that you see in the younger kids. Yeah, but I can't say for sure that it causes this low platelet aggregation. Okay. All right, so we did all that. Now we're down to the last one. Again, this is one of the newer things that we're figuring out, is that you got to get enough quality sleep. Right? The American Sleep Medicine Society recommend that adult above 18 get 7 to 9 hours. If you're a teenager, 8 to 10. If you're a baby, 4 to 6 months, 12 to 16 hours. Sleep is important because it maintains the healthy balance of hormone that allows your body to feel hunger or feel full. Without that balance, you're eating, you're doing things that your body says, I don't know why I'm hungry. Okay? So that hormone that causes that is something called ghrelin. Actually, it's like ghrelin, like if your stomach is growling. If you have an imbalance of that, when that thing kicks in, you're looking around to eat, you have no idea why. And you cannot get that to settle down till you hit some calories in your stomach, and that loop come back to the brain and said, oh yeah, I got something for you. Right? Otherwise, you're just looking to eat. You don't know why. Of course, it supports the healthy growth and development of the brain, and more importantly, it supports your healthy immune system. People who are lack of sleep have horrible health, and they can't figure out why. It's because their body can't repair itself for the 8 hours that it needs every day. So over time, if you don't get enough sleep, you get a thing called sleep deficiency, and we know that can raise your risk of heart disease, obesity, high blood pressure, diabetes. All right. So just to summarize, healthy heart living, you got to understand your risk so you know how to modify it. Get your blood pressure and your cholesterol checked. Choose a heart-healthy diet and stick to it if you can. But if you can't stick to it exactly, anything that you can do to help get you there helps. Get regular physical activity. Stay in a good weight, 25 BMI or below. Quit smoking. Manage your stress, get good sleep. And take this thing and look at it. Once in a while, look at it, see if you make changes. Any changes is good, remember? Any changes is good for you. Yes?
Should a person take a baby aspirin daily?
It depends.
Yeah.
Right. So the
Yeah, I know.
yeah. So if you go on the internet, even on this site, if you look at the National Heart, Lung, and Blood Institute, which is right down the bottom, this little thing. If you go on there, there is a calculation that figure out what your risk for coronary artery disease in 10 years. Okay? So the recommendation right now is if you don't have risk, the aspirin doesn't do you any good and may harm you. But if you have risk, and risk for intermediate is between 7.5 to 19%, if you're in that range, yeah, that's when you say, yeah, I think an aspirin's going to help me. Now, if you're above that, obviously you're on aspirin. Right? So look at your risk first. Any other questions?
Have you heard about intermittent fasting?
Yes, fantastic if you can do it.
Because all the things you're saying are concepts that I've learned through podcasts. The satiety of 85%, the insulin resistance, that kind of stuff.
Mm-hmm. Yeah.
That's how I lost my 30 pounds and I've kept it off by doing that.
Great, great. Yeah, if you can intermittent fast, you can reset some of that insulin stuff that's going on, right? So when I do it, mine is about 22, 24 hours.
Oh, and then you eat a 2 to 4 hour window or 2 hour window?
No, when I get to that 22 or 24, I get really cranky,
Oh.
and I have to eat. My neighbor that's an internist, his level is 36 hours. He gets a horrible headache and he has to eat. Okay? But the most extreme one is one of our guy that was in the hospital. He used to own an Audi TT, I mean, do you know what those are? Tiny little sport car. And he started out driving that thing, and then he gained so much weight he couldn't use it. And so he decided, okay, I'm going to lose weight. So he went on intermittent fasting. And I think his was into the 30 days or something. He lost 157 pounds. He lost one of me. But his goal was to be able to get in his little sport car and drive it. And that was his motivation. And he did. He still walked around with a bad hip, because when he gained all that weight, it just hurt his hip. It wore it out. Yeah. But yes, intermittent fasting, I think, is a great tool to reset.
You recommend it for like how many hours of fasting, like in a day?
Okay. What I normally do for my intermittent, well, I don't even call it intermittent fasting anymore. I think it's just normal for me. Okay. So I eat in around 6:30 at night, and then I don't eat anything. I don't do anything until about 7 o'clock the next morning is when my cup of coffee comes in. And I try to go to about 10 or 11 o'clock before I have a bar of something for breakfast. And I find that that's, for me, is something that keep my weight down even without exercise. Now, if I do that and I exercise, in a week I can drop 3 or 4 pounds. And everybody's different. It just depends on how you go.
So you only eat them like at 10 a.m. and then 6:30 p.m.?
No. So this is my normal day. Is by 10 o'clock I have my breakfast, whatever bar, and then by noon I'm eating. But since I just ate at like 10 something, noon I hardly ever eat anything. So I eat a very light lunch, because if I eat that 10 o'clock at noon, I'm not even hungry. So I eat something there, and then I don't eat again until 6:30. So by doing that, I decrease my calorie intake already, just by not snacking, not doing anything at all. And the coffee that I have at 7 o'clock in the morning, I don't think it does anything. It still allows my body to kick in that ketonic state, to tear down the fat, to use those to come out. Now, when you do this, when you first start losing weight, there's 2 types of fat. You're going to have your insulation fat. So the stuff that you pinch on the outside, it's going to stay there. That won't go. It will stay there a long time. But if you push on your belly, you know that it's softer, because the mesenteric fat, the fat that's on the inside, that's the bad stuff. That's the stuff your body get rid of first. So if you're trying to get a 6-pack ab, yes, you got to exercise to get that to come out, because your fat's not going to go on the outside. Yes.
Is there any problem with people who have low blood pressure?
So the question is, are there problems with people with low blood pressure? Yes. If you have low blood pressure, you can get lightheaded, and you can get these episodes where you just don't get enough blood up to your brain, especially when you're changing position, and you can get near syncope or passing out. So if you have that, first thing you have to look is, what's my fluid intake? And then what am I taking for medication? Now, if you've got no medication and you know that your fluid intake is good, then the other thing you look for is something called autonomic dysfunction. As we get older, our body can't make that adjustment from laying, sitting to standing because you're changing 5 feet. Now, so that blood pressure has to change, and there has to be vasoconstriction. If you can't change that fast, which we know we get older, that reflex decreases, then you have to look to make sure there's nothing else that's preventing you from doing that. But in terms of heart disease, is that what you're alluding to? No, it does not cause any problem with low blood pressure.
You mentioned sugar. What about artificial sugars? I can't stand them myself, but a lot of people use them.